Good day. I am Clarice Escabosa of BS Psychology 3C, and I am here to have a discussion about Introduction to Abnormal Psychology and its historical review. So, hello there, psyches. So, what is psychopathology? So, psychopathology, it is a study of nature, symptomatology, development, and treatment of psychological disorders. So, whatever disorders that it is, like schizophrenia, bipolar disorder, is one of the examples of a psychological disorder. Challenges to the study of psychopathology, like maintaining objectivity, avoiding preconceived notions such as predicting the disorder of your patients without proper study, and then reducing the stigma, because reducing a stigma is not that easy. We have to undergo more studies to reduce it. So there are key characteristics in the DSM, or the Diagnostic and Statistics Manual of Mental Disorders: the personal distress, disability, violation of social norms, and dysfunction. So personal distress is the stressors of a person, the disability, whether the person has is mentally incapable, and then violation of social norms. So social norms are not indicated in the DSM because it is not scientific, and then the dysfunction of the DSM, it is included. The disorders have dysfunction of a person also. And then what is a stigma? So a stigma, it refers to the destructive belief and attitudes held by society and that are ascribed as groups. So is considered that it has different manners, such as people with mental illness. So a people who are unique and different, such as unique personality or has a disability in physical, they are prone to stigma because other people think that they are different. That's why they bully them. So there are stigma. First is the distinguishing label is applied. For example, if a girl is malnourished, so people will call her like a thin and other hurtful words. Then second is label refers to undesirable attributes. So it's okay if a person will label you beautiful and appreciative label, then it would be okay. But then the stigma is people will call you negative things. That's why the person feels awkward and sad. And then people with the label are seen as different. Yes, like those people who are blind or have a physical disable or the mental ability is not high. That's why they are prone to bullying. Then lastly, people with the label are discriminated against. So it's true, they are the high risk of discrimination. So the Diagnostic and Statistical Manual, or the DSM-5, is a widely accepted system in the whole world. It is used to classify psychological problems and disorders. So a disorder is like a major issue already, and while psychological problem is a minor issue. So the DSM 1, 2, 3, 4, and 5 contains diagnostic criteria for behaviors that fits for a pattern, It causes a dysfunction and subjective distress and are present for a specified duration of time. Like for example, he have that depression for a long period of time already, so it needs medical attention. And for behaviors that are not otherwise explainable, so there are really many behaviors that are not explainable by the normal, by the daily life, like schizophrenia, whereas the victim of schizophrenia suffers from hallucinations and delusions. So the DSM-5, it is described as a behavioral, psychological, and biological dysfunctions that are unexpected in the culture. So it is associated with present distress of a person on what he is experiencing and impairment in functioning, such as like there are people who can't, like dyslexia, they can't read properly, so they are consulted using the DSM-5, and then increased risk of suffering. So yeah, those people like who are suffering from depression, they are really prone to suffering, and those who have schizophrenia because of their hallucinations, delusions, and many other example of disorders. So they are also prone to death because of their mind. So the pain because of other people, the stigma is high, or the impairment. Like they can go to work because they have that disorder. And then to scientific study of psychological disorders, they are called the mental health professionals, the counseling psychologists or the PhDs or the clinical psychologists. There are many types of psychologists like forensic psychologists, and there are also the clinical and counseling doctors of psychology, the registered psychologists, the psychiatrists, the psychiatric and non-psychiatric social workers, and the psychiatric nurses. So any of those, if you encounter, interact, or if you are looking with someone who can help you with your mental illness, then you can look for those people, for those professionals. So now let's talk about the history of psychopathology. So where does it begin and when? First, demonology. So it sounds scary, but so what is demonology? Demonology is a doctrine that an evil can dwell within a person. So it is been so a person who has been encountered by an evil inside his body, he will be healed using exorcism. And then the trephination and hydrotherapy. So hydrotherapy, it means that like the holy water, that a person who is infested by an evil spirit, it is believed that he can be healed through hydrotherapy. First, the early biologists, first is Hippocrates. Hippocrates lived in 5th century BC. He believed that mental disturbances have natural causes, not supernatural. So he believed that it is like biological causes, not because of supernatural, like they seen something horrible or a supernatural cause that mental disability. Then there are three categories. He believed that there is mania, melancholia, and phrenesis. So mania, it is a chronic febrile psychosis with a yellow bile disease. Then the melancholia, when a fear and sadness lasts a long time. Then the phrenesis, it experiences fever, mental status, change or acute onset of the disease. And there and for the four causes of the mental disturbances that Hippocrates believed is blood, black bile, yellow bile, and phlegm. So now let's proceed Dark Ages, in which monks cared and prayed for mentally ill using the concocted potions, and then when the Christianity is already civilized, the papacy made a law that Christian monasteries replaced physicians as healers and not those witch anymore. So in the old, so witches are believed to be evil. That's why they persecute witches. So before they and until now, they seen as witchcraft as Satan and a denial of God. So historians conclude that witches are mentally ill and should be tortured. So they believe that witches are not in the proper mind. That's why they torture those witches. So yes, and then let's proceed to the lunacy trials. It began in the 13th century in England. So municipal authorities assumed responsibility of care of mentally ill. So the government and the municipality held responsibility for those people who are mentally disabled. So there are trials held to determine sanity. So whether to conclude if that person is healthy mind or not. Then the trials were conducted under the Crown's right to protect the people with mental illness. So they really care for the people who have mental illness. Then, what is lunacy? So lunacy, it attributes insanity to misalignment of moon and stars. So before, people believed that when a person becomes crazy or insane, it is because of the misalignment of moon and stars in the universe. Then the mass hysteria. So it is characterized by large-scale outbreaks of bizarre behavior, like all people in that place are already suffering from depression. Pinel's, re- Pinel's performs and moral treatment. So Philippe Pinel, a French psychologist, he pioneered humanitarian treatment of at la bisatir. So it means moral treatments. So like patients who are mentally incapable undergoes like relaxed activities like gardening and talking in the moral treatment. So not because of medicine. Next is Dorothea Dix. So she is a crusader for prisoner and mentally ill. So she is like a hero for those who are in prison and mentally disabled. So she urged movement to the improvement of institutions. She worked and established 32 new public hospitals for mentally ill also, and hospitals staffed with physicians. And she is also known as for the mental hygiene movement. So she is devoted to mentality. So there are early foundations, the biological approaches of psychopathology. General paresis or general paralysis. It is a degenerative disorder with psychological symptoms. So it is commonly caused by syphilis. So someone who is like brain paralyzed are believed to be caused by syphilis. So there are also genetics and eugenics. So Galton's work led to notion that mental illness can be inherited through genetics. So there are behavioral genetics. It means that to which behavioral differences are due to genetics. So the behavior of a person are like passed from ancestors to from his mother or father. That's why he behaved like that. Then the eugenics. So it is the promotion of enforced sterilization to eliminate undesirable characteristics from population. So it is basically meant to choose who you meet so that mentally mental inability people can be avoided. So there are also insulin coma therapy. It is created by Manfred Sackel in 1927. It is also a form of psychiatric treatment for those who are in comatose. Electroconvulsive therapy, which is still used until now. It is created by Serliti and Bini in 1938. It induces epileptic seizures with electric shocks. So for those people who are suffering from brain injuries. So next is prefrontal lobotomy by Igas Moniz in 1935. It often leads to listlessness, apathy, and lack of some cognitive ability. So it's not good because people will lack emotions, and then they will be forgetful. And then there are early foundations of psychopathology. Emil Kraepelin pioneered classification of mental illness based on psychological causes. So he published the first psychiatric test in 1983 and considered mental illness as a syndrome. So he proposed two major syndromes, the dementia praecox and the manic depressive psychosis. Next is the early foundations or the psychological approaches. So Mesmer. Mesmer is a psychologist. So Mesmer treated patients with hysteria using animal magnetism. He is also the early practitioner of hypnosis called mesmerism. So next is Joseph Breuer. So he used hypnosis to facilitate catharsis. So what is catharsis? Catharsis is the release of emotional tension triggered by reliving and thinking about the event like in the past. So he used hypnosis to forget the catharsis or to forget a traumatic event. Next is the Freud psychoanalytic theory. So human behavior is determined by unconscious forces according to Sigmund Freud. So psychopathology results from conflicts among these unconscious forces. It's believed because of the Freud's kanang id, ego, and superego, or which is commonly called as Freud's structure of the mind. So the id, or the evil mind, is the unconscious pleasure principle, immediate gratification, and libido. Then the ego. It is a primarily conscious reality principle, so like the dreams. In this attempt to satisfy the id's demands within reality's constraints. Then the next is the superego or the morality. It is the conscience. It develops as we incorporate parental and societal values in our daily lives. So next we will talk about the Neo-Freudians. So first is Carl Gustav Jung. So he is the founder of analytic psychology. He incorporates Freudian and humanistic psychology. So he believed in the collective unconscious, and there are four archetypes: the self, the persona, the shadow, and the animal. So the self is our the what we are hiding in ourselves. The persona is what we show to the world, and then the shadow and what's like behind our back, the subconscious mind, and then the anima. Next is Alfred Adler created individual psychology. So it is made to fulfill the mind with working for through working for the social good. Then next is continuing influences of Freud and his followers. So this Freud believes that childhood experiences help shape adult personality. So whatever you experience in childhood makes what you are in your adulthood. Then there are unconscious influences on behavior. Like you don't know why you influence that behavior, but because of past interactions with people, that's why you have that behavior. Then third is the causes and purposes of human behavior are not always obvious. So next is the rise of behaviorism. The first psychologist is John B. Watson. So he created emphasis on learning rather than innate tendencies. He believed that learning is more vital than the innate or the genetic side of behavior. So he focused on observable behavior and he created the classical conditioning theory. Next is Ivan Pavlov. So he has the conditioned stimulus, unconditioned response, and conditioned response. So next is Watson and Rayner by John B. Watson and Rosalinda Rayner. So they classical conditioned fear in the for little Albert, which is a 9-month-old baby. So next is the operant conditioning by E. Thorndike. So it is operant conditioning of a dog. So it is through learning through consequences and the law of effect. So like a dog will learn because of punishments. Next is B.F. Skinner. He created the principle of reinforcement, the positive and negative reinforcement. So positive reinforcement, our behaviors followed by pleasant stimuli are strengthened. So those who are appreciative words. Then next is the negative reinforcement or those negative actions. So are those behaviors that terminate a negative stimulus. Next is modeling. So modeling, it is learned by imitating others' behavior. So it can occur without reinforcement or punishments or something positive or negative. It is created by Bandura and Menlove in 1968. So modeling reduced children's fear of dogs. So like when parents teach the children to be playful with the dogs, so it will decrease their fear of the dogs. The next is behavior therapy. So the systematic desensitization, which means the evidence approach to help slowly overcome a phobia. So an evidence-based therapy, then aversive conditioning is used of a something unpleasant or a punishment to stop an unwanted behavior. So next is the cognitive therapy and rational emotive therapy. So it is based on the idea that people not only behave, they also think and feel the cognitive and the emotions. So it emphasizes that how people act with themselves and the world is a major determinant of a psychological disorder. So it is about the mind and the emotions balance. So yes, and that's all. Thank you for listening and have a great day ahead. Bye.